Some of the things that we would do, how would you know? As I said, you can start to use Dr. Barnes' temperature and pulse references, or you can start to use blood labs looking at all the symptoms as well. So the labs, if you're going to get labs done, most people only get the TSH. Antibodies is another lab test you need to get done as well, TSH. T3 and T4. You also need to look at what's more important is the free bound T3 and T4. That's the number that will really affect. If those numbers are not in the normal parameters, that's when you're going to start to see all the symptoms of cold hands, puffiness and so on. The T3 and T4 by itself does not give you enough information because they're already bound with what's free and what's not. It's like a free radical, what's not acting properly. If these numbers go too high, that's where we start to see the major problems. Adrenals, so I would get the adrenals tested, so we do a cortisol test. So usually you do that with a vial, a saliva, 3 to 4 times a day, and they give you your lab test. GI labs, so again, looking at gastrointestinal function, looking at what digestive enzymes are there, might look at live blood culture, might look at a stool test or urine test as well. And then expanded chemistry profile. So there's a lot of things, as we said, if you're deficient in zinc, if you're deficient in selenium, if you're deficient in magnesium, you're not going to be able to start to heal the thyroid, and you're going to start to see more aggressive symptoms. By just sometimes getting people to eat normal foods that have those foods in there, we don't have to take the supplementation. But sometimes it's better to look at some of the magnesium, some of the iodine drops, and bring in some of those foods naturally that you can use in as well. And then working with your doctor, see how the medication is working, and then go from there. Immune system also has to be checked. And then the last one is estrogen dominance. Okay? So, common antagonists or common antagonists that are missed for adrenal function. I think you have these. Skipping meals, estrogen, as I said, fluoride, chlorine exposure, that's another one. Nutrient deficiency, watch out for B vitamins, iodine is what we talked about. We've already talked about soya, but also these millet, gluten, wheat and dairy. So if I have a client that has thyroid issues, that's what they need to come off to see if that eases the symptoms and see if they do have an allergic reaction or sensitivity. Not everybody will have that, but we do know that these cause issues with the thyroid, and gluten itself causes the gut lining to be permeable for up to 5 hours. So that's the latest research, even if you're not gluten intolerant, which means that the lining of your abdominal wall will allow other food compounds to come in. It's got a kind of an inflammatory response, and therefore any foods that you eat with the gluten will come into your bloodstream. That means they shouldn't be there. So your white blood cells start to attack that, and that starts a leaky gut or an irritable bowel syndrome. So a lot of people don't realize when they start to eat foods that cause this inflammatory response, anything that's eaten with them, and it could be something like cheese or nuts or whatever, then you'll get a response to those too. And it was generally some of the other foods that started off that response. Some of the other things we look at, we talked about per gut, eating inflammatory issues, autoimmune issues, pesticides, and this is a major reason for me here for organic foods to get rid of all of these out of our foods. Heavy toxins we talk about, the metals. Excessive cardio, what that does is release glucocorticoids, and glucocorticoids are a catabolic hormone that raise inflammation in the system and release more cortisol. So more cortisol will be elevated, and cortisol sets off that stress response. So therefore, if the body doesn't have the hormones to run that, you start then seeing the thyroid start to get affected, and that's what starts this cascade. Insufficient protein intake we talked about, candida, lack of fatty acids. So again, not having the right fats. One of the biggest ones that you want to cut out from your diet is polyunsaturated fats, or PUFAs. So those fatty acids. Excessive iron, not very common, but something to look at, and congested liver, as we've seen. So what I do first when I have a person that comes in with thyroid or hormonal issues, I go back to what we call the first 4 control centers. The 4 control centers for me are digestion, immune system, hormonal, and detoxification. If I have any problems there, I know that these are all interlinked. So if your detox pathways are blocked up, if you're using something like a deodorant, which clogs up your skin is 20% of all detoxification. Your breath is 70% of all detoxification. Defecation is 7 and urination is 3. So if you're putting antiperspirants on, you're clogging up 20% of your natural detoxification. Breath, if you're not breathing properly, if people don't breathe through a diaphragmatic breath, so that's why we spend a lot of time assessing breath and teaching people how to do things like yoga and Tai Chi or Qigong, or what we do is zone exercises, which is from Paul Chek's book, How to Eat Movement Healthy. It's a concept of kind of modernized Qi movements, breathing paces, very gentle work. We also then can help people then release through diaphragm. We may have to re-coach, secondary muscles, or release scalenes or upper cervical muscles that are really tight. So they're the secondary muscles. When we breathe, the belly should expand first, and then the rib cage, and then we sometimes see scalene elevation. But a lot of people we see in a stressed manner, they breathe, and they breathe with the chest up, and you see the scalenes activate. So they can wind up the system too. Immune system as well, we start to see what foods they're taking in. We look at their food logs, and we start to see their sensitivity to different things. And digestion, so reflux, all those different things. The skin tells us a lot about what's going on. And then our defecation. So Paul has a book, as I said there, but in the book it talks about digestive problems. And one of the things that we look at is stool samples, or looking at your defecation to see if there's any problem, because what comes out at the other end tells you a lot about what went on inside. And if you don't have a proper bowel movements, if you're constipated, or the stool is not formed properly, so if it's dehydrated, you see all the little pellets. If it's runny, it can be a hypercolic or a hypertransit time, so the food is not staying in the gut long enough, and that can cause problems. So cholesterol levels rise under stress, and these kind of slides here, I just want to go through really quickly. There's also adrenal exhaustion here that we need to talk about, because that's a huge epidemic at the moment. I would say probably around 80% to 90% of people have some sort of moderate or to high adrenal stress coming in to see me now these days. And I've seen that elevate now over the last 7 or 8 years. And I've been only aware of it for about 12 or 13 years working with the Czech program. So they're tied into 3 body systems, and the hormonal system, the detoxification system, and the digestive system. If you have one that gets stressed, you'll have all stress. It will lead over. So if you have a thyroid issue, you're going to have some digestive stress and detoxification stress. So therefore, if I work on the digestion and the detoxification and the hormone, that's a full approach. That's what we call a holistic approach, not just chasing the hormonal system. Again, too many people chase the knee, and most of the time it's a foot problem or a hip problem. It's not just a knee problem or a shoulder problem. And this is just to use another analogy. So the symptoms usually overlap and spill over to the other. Most hormonal problems are brought up by years of poor lifestyle choices combined with digestive and detoxification issues. So many people don't realize they've got food sensitivities or allergens, or they have effects to certain foods, and they cause a response, an inflammatory response, which then turn over into the hormonal complex. So if we look at the digestive system, it's quite a big system. I'm going to flick through a couple of these slides here, but one of the most important things for me is test to see if you've got any food allergens or sensitivities. So food can result in inflammation, visceromotor or viscerosensory reflexes, which mean that the viscera, which is the organs inside, you can have a motor nerve get kind of hijacked. It's a viscerosomatic reflex, and what happens is the motor unit for, say, your core, if you've got intestinal problems, your lower back muscles and your inner unit, your transverse abdominis, your pelvic floor, could shut down. So a person that has a digestive issue and insensitivity, for all intents and purposes, could be suffering from incontinence. And we find out what's causing the inflammation, and then the incontinence is gone. Or they can suffer from a bad back, and when they find the food sensitivity has been dealt with or taken out, now the muscles start to work, and now the back can stabilize. A lot of people do Pilates and Swiss ball and core work, but then also don't look at the organs. So that's only a piecemeal effect. It's not the holistic approach. And that's what we do as CHEK. CHEK stands for Corrective Holistic Exercise Kinesiology. So we look at a holistic viewpoint, not just look at one part of the body. Immune system. So if you have food allergens to your immune system, so people that are constantly cold, sinus issues, always having to have the flu shots and so on, that could be an underlying sensitivity, and that there will also lead into the thyroid issues for females as well. Food combining tips. So here's a couple of tips for you if you're looking at foods. One of the big ones for us is using the digestive enzyme, hydrochloric acid. Sea salt. If you take in sea salt or Celtic sea salt, so Celtic sea salt for me is one of those wonder things that you need to have in your life. That or Himalayan salt is really good. So there's some Himalayan salt I see on the shelf over there. But just having good quality salts that are not ionized or not bleached and naturally harvested, they help to break down the food, so the pancreatic enzymes and so on. Look for digestive enzymes as well. Some digestive enzymes can really help, and start to look at broad spectrum ones. Try a couple of different, have one or two before, after your meals, depending on what it says on the bottle. But I found that you have to have a couple of different ones and rotate them. Don't stick with the same brand, because the more diversity you have, the better. All foods have enzymes. When we overcook foods, we destroy the enzymes. When we heat any food above 40 degrees, we start to break down the enzymes. When you're eating meats, always start with live greens. So if you have your salads or veggies, they have the enzymes in there to help break down the meats. Also, this one is very important. Your Brax apple cider vinegar. So anybody with digestive issues, a teaspoon of that before you eat can help your reflux, indigestion and so on. You can start to look at the fermented foods as well, very important. Start by drinking water. Try not to drink too much water with your meal, that interferes with digestion. Also, another thing to do is you can use lemon juice to see if you have a digestive problem. So you can squeeze a lemon, juice a lemon and take about a third of it before you eat your meal, and then halfway through your meal take another third, and at the end of your meal take the last third, and see if that cuts down any of your symptoms. If you do get a positive result, that you don't have any of the reflux or indigestion, then you probably need some digestive enzymes. And then the last thing I just want to kind of touch on, as I talked about soya, if you haven't seen this book, The Whole Soy Story, or The Whole Soy Story, Kayla Daniel just goes through, it's linked to PMS, ADD, a lot of people that have this a vegan zone diet as well are causing lots of problems later on in life. Kids formulas, not too sure if you're aware, France, all these other places have now warning labels on these, Israel, there's a couple other countries that banned it. Brings on severe cases with menopause, so it exacerbates your problems. It's one of the most allergic foods on the planet, GMO, genetically modified, and the list goes on and on and on. So